So hello guys, how you doing? And so let me thank you for making our first trial of this medium to be quite smooth and less problematic. So let's keep that up, and we won't with this approach. I don't think we would have any cause not to finish the syllabus as long as you are willing to do your part, and I'm available to reach you guys through any means. So over the past couple of weeks, what we've been doing is to have a much deeper understanding of what is happening at the cellular basis, because like I've been telling you guys repeatedly and repeatedly, we cannot say we are doing something standard if we don't have a good grasp of what is happening in the cell and how cells appear in normal conditions and in disease conditions. And so while it may look as if we've been looking at it from histopathology angle, and even though I said cells too are also the underlying mechanism for cytopathology and cytology, today what I want to do is to take us back into the laboratory so that we figure out, we understand how everything that we've been talking about over the past couple of weeks play out and can inform or guide clinicians and other members of the health team to understand what is wrong with the patient and decide the next line of action. So what we are going to be looking at today is still a slightly advanced form of what you've known at your basic classes on cytology. So I'll be introducing, I'll be doing some introductions, adding new details that you may have not heard before or that you did not understand. So that's what we'll be doing today. So get your notes ready, get any material that you're using ready, and like I always do, there'll be assignments, there'll be exercises, and so let's get it started with, okay? Exfoliative cytology, unlike histology, is quick and it's simple, and it's an important alternative to biopsy in certain situations. If you remember when I was introducing exfoliative cytology to you, I mentioned the fact that exfoliative cytology cannot be performed in all cases for all organs at all locations, that only certain conditions or certain locations allows you to perform exfoliative cytology. And we said we can only carry out exfoliative cytology at locations where cells have been shed. So if there is a location, if there is a fluid that is easily accessible and there is an organ or important tissue in that location that cells are being shed off into that fluid, then we can actually collect samples from the fluid, identify or isolate the cell, then analyze the cell to give us information about what is happening in the patient, if something is happening at all. And so I use this example of the mouth to denote a good example of samples that can serve exfoliative cytology diagnostic purpose. Okay, and so the saliva or the sputum are also the two of them would also allow us to understand the limitations, a major limitation of cytology. Okay, the precision of sample collection can be extremely difficult for some methods of exfoliative cytology. What am I trying to say? If you look at a sputum, sputum is the phlegm that comes out when you cough and you clear your throat. That mucoid, sticky, milky, colored substance is what we call mucus. Is what we call sputum. And in the process of production, we can collect, it would have passed through the respiratory tract, going sometimes as down as the lungs. So when you collect sputum, but even though you are collecting it from the mouth, it should have passed through the various organs, various compartments, various systems, various tissues. And except you are really, really good about cellular morphology and how individual cells are able to look, the distinguishing features between the specific features of individual cell, you may not be able to categorically state that this cell that we've collected, that we've identified in the sputum, is actually from this part of the tract or not. So that is one of the drawbacks. And the way to manage this, the way to handle this situation, is for you as a person, is for you as a scientist to fully understand, especially you as a cytopathologist, to fully understand how individual cells from this part, from the various parts of the body look like, so that wherever you are seeing them, you can specifically identify them. However, even if you're able to do this, because in many of these samples that we are looking at from disease conditions, and if you understand the way in the class of cellular adaptation, when things are wrong, when there is a unique stimulus, when there are excess stress on the cells or tissues of a particular body, then things happen differently, and the cells adjust its structure and sometimes its number for it to be able to accommodate the new pressure. And so things may not be looking as it should be looking in the ideal picture. So even when you know how the lung cells look like, and there is something that is wrong, an abnormal lungs cell of the lung may actually look like a normal cell from another part of the respiratory tract. So that is something that you should always have at the back of your mind, that the cells do not look alike, cells don't look alike, and so you should be precise and absolutely sure about where you are collecting the sample from, and how the individual cells look like in normal state and in disease state. But in comparison with histopathology, especially biopsy, in which we are going directly to the organ or tissue affected to collect samples, so we are 100% sure of where the sample is coming from, and we can absolutely say that this is what is happening. But there are lots of differences, there are lots of advantages that cytology will continue to have over histology, and the simplicity of the methodology, its cost effectiveness, the quick turnaround time, the minimal expertise required, the cost, the lower cost, the lower risk of complications, and several other factors, that continue to put it ahead in terms of popularity over, and in terms of easier access over histology investigations. And when you look at conditions such as breast cancer and cervical cancer, like I've mentioned before, and if not for the simpler way of screening patients for these conditions, the number of patients that would have been dying of breast and cervical cancers would have even be higher than what we currently have today. And if you remember the class 2, when I was mentioning breast cancer 2, you remember I also mentioned that cytology, this aspect of medical laboratory science, allows us to also to also achieve preventive care as histology and cytopathology major. So because when there are ways that we can prevent breast cancer, if a woman comes for routine breast examination, she sees a strange lump, fine needle aspiration is carried out, and the lump, the status of the lump, whether malignant or benign, is quickly figured out. And if it's benign or malignant, quick decision is made, and to remove or not to remove the tumor depending on its appearance are made. So such analyses are able to enable the patient to prevent breast cancer. The same thing also goes for cervical cancer. Women are required to do routine pap smear, so when they are able to do it frequently and we are seeing atypical cells that I'm going to further expatiate on later in this course, in this presentation, and so when we are able to see that something is happening differently and the woman is treated on time before atypical cells becomes malignant and fully abnormal cells, then there is hope of helping the patient. So you should be able to know what you're talking about, the drawbacks of cytology and the drawbacks of histology. So what I want you to quickly do is, since you guys are men, if each year old one of you should write two advantages, two advantages of cytology over histology. Cytology can be cytology or cytopathology over histology or histopathology. Two advantages of cytology that cytology has over histology, and two advantages that histology has over cytology. I want you to write your answers in the comment section. Don't repeat what another person has written. You know the rules. So I'll move on. So exfoliative cytology, because there are different methods, there are different types of cytology. So be careful about the way you define this terminology. So exfoliative cytology categorizes collected samples only by analyzing the presence of abnormal or atypical cells, or by showing the presence of malignant cells. So what we are checking in the cytology lab is the fact, what essentially we are looking for in the samples that are sent to the laboratory, the cytology laboratory, is we are making decision over whether the cells that we are looking at are normal cells or they are abnormal cells. Okay, you understand? You know what normal cells look like. We know how abnormal. So if they are not normal cells, then they are abnormal cells. But these are two wide extremes that in practical sense are not clearly like that. So what I'm trying to say is this: when a normal cell, if something is wrong with a normal cell, remember the cycle, adaptation sets in, the cell tries to adjust and pushes itself to the limit and do everything it can to ensure that homeostasis is maintained. So, and when this is happening, cells, procedures, conditions such as manifestations such as hypertrophy, hyperplasia, and even metaplasia can present. So when you are seeing this, to a minimal extent, so we can say that even though the cells are normal, but they are atypical. Atypical cells are entirely different from fully abnormal cells. So in atypical cells simply refers to deviation from, slight deviation from how the normal cell is expected to look like. Okay, so and this is usually the first stage of many disorders, even cancers. So they always start with just being atypical, slight deviation from the normal cell, how the normal cell looks like. So that is the starting point for many diseases that affect the cells. So you figure out, okay, these are atypical cells, they are normal, but they are not, okay, they look normal, well, they are normal cells with mild modifications, okay? Now, when that is what you are seeing, okay, you will report that. But when you are no longer seeing atypical cells, or when you are no longer seeing cells that still look like the normal cells, perform like they act like the normal cells, but what you are now seeing are malignant cells, then you report that too. Then what are malignant cells? They are cells that fit into the rules for the criteria for malignancy. You know the criteria for malignancy, and I think everybody should write two distinct criteria for malignancy. What criteria for malignancy, you know them, so write two distinct ones in the comment section, and don't write what another person has written. So cells that have those features, they are malignant cells. So that is what we are doing in cytology is not magic. Firstly, you look at, are they normal cells? Okay, if they are not 100% normal cells, so are they slightly different from the normal cells? that is atypical cells. Now, if they are far different from atypical cells, then what are they? Are they malignant cells? So these are the three essential features that we are looking at in cytology. So you are looking at abnormal or atypical cells and malignant cells. So when you see this, that is how you interpret. That is how decisions are made and for further investigations. And I want to add something. In many cases, ideally, in ideal situations, what is expected to happen is that after your cytology report, further investigations can be indicated. What am I trying to say? Let's say you've carried out fine needle aspiration, okay, and you are seeing malignant cells from the lump, from the sample collected from the lump, from the female, from the woman's breast. You are seeing malignant cells. So how we have to know, because there are different lumps on the breast. The woman may not have one lump, and cytology will not tell you the location of the malignant cells. Don't forget, let's say you have a circle, okay, and inside that circle, any spot you have numerous cells inside that circle. Now, let's say you have 500 cells inside that circle. Not all the 500 cells are malignant. Let's say only 20 out of that 500 cells are malignant, and they will be, let's say, they will be localized in a specific region of the circle. In cytology, we may not be able to say that this is where these malignant cells are located. Okay, but it will tell us that they are malignant cells because the fluid is a fluid that we are working with. So we now need biopsy. So we can say that cytology serves screening purpose in ideal setting. Okay, what happens in our clinics are not the ideal settings, but I'm telling you what the ideal settings is. So it will serve a screening purpose. Okay, there are malignant cells. So the next line of action will now be, where are the malignant cells located? So how do we identify the malignant cells? So this is where biopsy comes in. Biopsy is like the surgery. They would look at the tissue or the entire organ affected, and they can actually say that this is the area where the malignant cells are located. So if we can be able to precisely identify malignant cells, and you may start asking yourself, so what is the essence of cytology? Without cytology, without this very important screening tool, we will not be able to quickly identify patients with these conditions. And without being able to have a cheap, quick, and simple tool or methodology to screen patients for cancer, which cytology provides us with. Many people would have cancers because, don't forget, biopsy analyses are very, very expensive. They are tedious, they are cumbersome. It's as if they are carrying out surgery on the patient. So many people would not be able to access that kind of service. But with cytology, we are able to restrict, we are able to avoid wastage of resources. We are able to only ensure that people that have probable cases of cancer, people that have malignant cells, are the only ones that are being tested for, that biopsy is being carried out on them. So be able to understand this point. If it's still not clear, let me know so that I can further simplify this for you. So if a woman, if pap smear is carried out on a woman and she does not have malignant cells, but she has atypical cells, so you as a scientist, what do you think would happen? I think what is going to happen is this. You cannot say because there are atypical cells that you should now start treating the patient for cancer. No, that is not so. So what you can do is this: if there is an infection if an infection is going on, you can quickly address the infection. Then after addressing the infection, you will still have ask the patient to come back, depending on how the proportion of the cells that are atypical. Don't forget, atypical cells are different from malignant cells. So if you are seeing few atypical cells, you can say, okay, come back in the next 12 months. Okay. After they've tested her for the various viruses and she's okay, you ask her to come after the 12th month to test, so that you can repeat the test. And this is only for cervical cancer, because if you remember my previous classes, cervical cancer pathogenesis, the phase from infection to this full-blown disease takes up to 10 years. But because we are seeing atypical cells, abnormal cells, but that are not malignant, we ask the patient to come back within in the next 12 months. But if there are lots of atypical cells, you may ask her to come much earlier, let's say 5 months, so that we'll be able to know that whether the stuff that we have treated, whether things have become normal or not. So it allows us to monitor patients. It allows us to stop disease progression. So that is what I'd like to quickly mention. So let's quickly talk about the various collection methods. You can mention cytology sample collection methods that you know. There are lots of them, and I know you know lots of them, but there are different methods of classifying them. If you open various textbooks, you'll find different methods of classifying exfoliative, cytology, sample collection methods. So, but something that I personally think captures is good enough is a classification method that relies on the presence or absence of force in collecting the samples. So going by this method of classification, we have two broad groups of exfoliative cytology sample collection methods. They include spontaneous exfoliation and mechanical exfoliation. Spontaneous exfoliation and mechanical exfoliation. In spontaneous exfoliation, what is happening is that we are just picking cells that have already been shed. We are not the one that are dislodging the cells from the tissue or organ. Okay, we are collecting samples. We are collecting cells that have been spontaneously shed spontaneously shed. While in mechanical exfoliation, we are manually dislodging the cells. Okay, we are manually scraping or brushing off a surface in the body. So we are using force. We are agitating, we are applying force to scrape the cell off. And if you look at all the available methods of sample collection, they will fall in under either of these two. So, but if you are still not sure about what I'm trying to say, a good example of exfoliation is when cells of the pleural cavity or peritoneal cavity are shed into the peritoneal or pleural fluid. You know what pleural fluid is and what peritoneal fluid is. I think one of you should define pleural fluid and peritoneal fluid with the locations where they are. So don't forget, they are located in the cavity. Okay, and a structure makes that cavity, has created that cavity, and the water is not hanging in the surface, is being poured into a particular space. So there are structures around them. So cells of that structure, of the pleural cavity, that can be deposited into the pleural fluid. So what happens is that we now collect the fluid, the pleural fluid or the peritoneal fluid, depending on where we are interested in. We are now going to spin, we are going to treat, we are going to treat that fluid so that we can isolate cells from the fluid. So when we do that, we've not forced anything out. So what we've done is that we've carried out, we've collected samples using spontaneous exfoliation method. I hope that's clear to everybody. While for mechanical and okay, the way that we collect fluid for spontaneous is they are numerous. Okay, there are lots of them, and so we'll look at them in fuller details under individual method. So, but for mechanical exfoliation, the popular pap smear is a form of mechanical exfoliation, because if you understand how sample collection works, I think your first assignment is to write a summary of sample collection for pap smear. Okay, a summary of sample collection for pap smear. It should not be more than a summary. You know, a summary is short and precise. What are the key things that you are going to do when you want to collect samples for pap smear? So send it to my email address. You know my email address, so send it to me right away. And so when you understand that we are actually scraping. Okay, sample collection for pap smear requires scraping. We are using a tool to scrape the outer portion of the cervix. We use a spatula. Some call it a spatula, some use the terminology cervical spatula, because there are different spatula for every purpose. So that is a kind of force. Okay, active agitation using mechanical structure. So that is mechanical exfoliation. And another method is bronchial washing. Another method that requires energy or force or that is mechanical in nature is bronchial washing. In bronchial washing, you know the bronchioles, okay, and we are using a bronchoscope. What a bronchoscope is like a rubber that is passed through into the patient, and you can actually direct that tube into any vacuum, into any space in the GIT and the respiratory tract that you want to collect samples from. So using a bronchoscope, we deliver water. We deliver fluid into desired region. We manually agitate, then the water is sucked back and is analyzed to see if cells are being shed into it. The reason why that is important is that the bronchoscope usually contains a camera at the top, usually, so that you can guide it. And there is a monitor that tells you where it is, and when you see areas that you have reached, then you can stop at that area